Good morning and welcome to Payne Theological Seminary's Thriving Congregations panel on COVID-19 in the Black Church. This is our first virtual panel, and so we're very excited about it, and we'll be looking for some of your feedback along the way. We received a grant from the Lilly Endowment just a few months ago uh, entitled Mapping the Future of Black Methodism to help Black Methodist congregations thrive. Since we received those funds, of course, we've had COVID-19 become a real issue in the lives of everyday congregations, and some of us still haven't been able to re-enter our churches yet. And so the question is, how do we learn to live with this during the time that we must? And then how do we look at thriving afterwards? Because because there will be an out of this and after this that we will face. And so the question is, how will our congregations begin to thrive again? And so we felt that part of addressing that question, the larger question of how we will thrive again, involved facing what's right in front of us, which is the COVID-19 virus. And so again, I want to welcome you here to this broadcast, and I will allow Mr. King to come and introduce our panelists and speak more about today's presentation. Thank you.
Thank you, President Brown. As President noted, I'm excited at some point here very shortly to present Reverend Dr. Holly, newly minted interim dean at Payne, who will in turn present our keynote. But in the meantime, let me first acknowledge a few housekeeping matters. This being a live webinar, you will be muted throughout the presentation. However, please present your questions in the Q&A feature. Otherwise, reserve the chat box for any Zoom-related challenges you encounter. Going back to the point about the Q&A feature, with the remaining time we have after our presentation, I will present a random sample of questions to the presenter to address. Otherwise, know that we will catalog questions and present the fullness, or those answers anyway, the fullness of those answers at a future date. Finally, after the presentation, Dr. Holly will return to close us out. I am pleased to present to that end Reverend Dr. Holly. Her strategic mind, as President noted, we have established a vision around thriving congregations, and Dr. Holly has certainly seized that vision with very important strategy. In fact, that strategy facilitates this occasion. And that same strategy brought to Payne the groundbreaking work in which she's involved around ecological theology. Even that same strategic mind positioned Payne to be the first seminary to house the Smithsonian's What It Means to Be Human. Dr. Holly, not to embarrass you, but you once wrote, and I quote, considerations relevant to human welfare should never be engaged apart from considerations relevant to the welfare of the whole world with this rich and fragile complexity. I know no better way than to present all of the great work you're doing and will do for pain than that. Please, Dr. Holly.
Thank you, Mr. King. It is my honor to present our presenter this morning. Our presenter for this inaugural Pain Seminary webinar, COVID-19 and the Black Church, is the Reverend Doreleena Sammons Hackett. Reverend Hackett has a Master of Science degree in Public Health Nutrition from the Harvard School of Public Health in Boston, Massachusetts, and a Bachelor of Science degree in Pre-Medicine from Bennett College in Greensboro, North Carolina. She is a certified public manager, having trained at Rutgers, the State University in New Brunswick, New Jersey. She is a certified master trainer in chronic disease self-management, having trained at Stanford University Patient Education Research Center, and she has served as an associate minister at the First Baptist Church in Highland Park, Largo, Maryland, since 2011. Reverend Hackett has 27 years of experience in chronic disease and health promotion, program development, and implementation, including nutrition, cardiovascular disease prevention, gerontology, injury prevention, women's health, HIV/AIDS awareness, health education, physical activity, and program integration. She has 10 years experience in maternal and child health, over 30 years experience working in state and local health departments, and 10 years experience working in nonprofit section, 3 of which was an executive director. Her experience is extensive in areas of policy, environment, and systems change, providing technical assistance and capacity building planning, organizing and directing programs, development, implementation and monitoring of federal categorical grants and community-based grants, and physical management, including budget preparations and resource allocation. Reverend Hackett is presently the project director for the Racial and Ethnic Approaches to Community Health, known as the REACH program, Federal Cooperative Agreement, which is a nationwide community-based program to reduce racial and ethnic health disparities in cooperation with the CDC, Division of Nutrition, Physical Activity, and Obesity. She has a passion for health equity and the development of culturally sensitive community-based outreach and educational plays, videotapes, brochures, and training modules, along with participating on numerous national, regional, and statewide planning and advisory councils committees. I am glad to have this honor to present my college classmate from Bennett College for this Pain Seminary inaugural webinar event. Now we will hear from the Reverend Doreleena Sammons Hackett. Hear ye her.
Good morning, good morning, good morning. What a glorious morning. I am so glad to be in your presence this morning. It's an honor. I want to thank President Michael Joseph Brown. Thank you, Dr. Brown. It's a pleasure to formally meet you. Dr. Betty Whitted Holly, you're my classmate forever for life, and I'm so glad to see you this morning. Mr. King, you've been wonderful, and Ms. Rankin as well. I just appreciate the opportunity to be able to come before you this morning to talk about COVID-19, which has had a tremendous impact on our people's health, as well as economic, social, and mental situations. I'm going to share my screen. Okay, go back. COVID-19 in the Black church. If that's what you signed up for, that's what we're going to talk about this morning. If you signed up for something else, stick around just in case you might learn a little something. Populations in situations of vulnerability are more at risk of the impact of COVID-19, often due to fragile living conditions, loss of income, loss of health insurance, and other drivers that lead to poorer health. These populations are people we serve in our religious communities called the Black church. I'll be going over the epidemiology of COVID-19. How did we get here? Are we going to vaccinate or not? What's the sociology of COVID-19 and what is the effect of racism? How about Blacks and this disease, Hispanics and the elderly? And I know some of you are serving Hispanic populations, and because the brown population is surpassing all other populations in the United States, we have to bring into context our brown brothers and sisters. Talking about a social distance praise. I know that you all want to get back to worship, so we're going to talk about a social distance praise, the isolation of our members and getting our praise on, and then opportunities to serve, giving back during the pandemic. Our objectives for today: to learn what the virus is and how it spread, to determine what racism has to do with COVID-19, to learn what comorbid conditions have to do with COVID-19, and to learn how to get your church back to a new normal, because things will never be the way they were before COVID. The numbers to date, I just have to share this with you, and the numbers are updated by hour. The numbers infected as of this morning are 8,455,267 people. The number that have died are 223,023 people. And I put the plus on there because there are people who have died at home that were not diagnosed to have COVID-19. So this number surpasses the 223,000 that they have been giving to us in the public. The updates are by the hour. Black clergy have died. I could only get the statistics as of May 2020, and I presume that they stopped gathering these statistics, but 20 to 25 Church of God in Christ leaders contracted the virus, and most of them had been at the same conference. They had died of the virus. ABC News identified at least 33 African-American bishops, reverends, and pastors. You see 7 in Michigan, including 2 from the same church, 7 in Louisiana, 6 in New York, 3 in Illinois, 2 in Mississippi, 2 in Georgia, and one of those had led a very packed funeral. And he contracted the virus and died, as well as several of the brothers and sisters of the person that was funeralized. 2 in Georgia, 1 in Virginia, Tennessee, Alabama, and 1 in Missouri. And I'm sure that some of you may be from these areas and may know some of these pastors, reverends, and bishops that may have succumbed to the disease. So COVID-19, a preventable pandemic, because yes, this could have been prevented, as we've seen by the political debates that we've been seeing, that this could have been prevented. Let me tell you what COVID-19 is. Coronavirus disease is defined as an illness caused by a novel coronavirus, now called severe acute respiratory syndrome, which is coronavirus 2, formerly called COVID-19. It's a respiratory illness that can spread from person to person. And yes, the outbreak did begin in China in 2019, in December 2019. And if we had known then what we do now, so many lives could have been saved. The basics, how we found COVID-19, and that's important to know how we found it. When new infectious diseases are discovered, scientists who are called epidemiologists work with other scientists to find out who, where, what CDC can do about it. That's the Centers for Disease Control and Prevention in Atlanta. And from the beginning, the COVID-19 outbreak, scientists and CDC have been working around the world to identify the source of this outbreak, monitor and track the disease, study the disease, and develop guidance to protect the public health. And that developing guidance to protect the public health is extremely important because we can't be protected unless we have strict guidance and we follow it. Why get guidance? We talk about Solomon and his wisdom. Why do we get this guidance if we don't follow it? Let's start with identifying the source. The epidemiologists went to China where the disease was first found, and they conducted studies in the community and on health facilities. And as you know, and I'm not political, but the current president pulled out the CDC epidemiologists that were working in China to study this disease. Before they left, they were able to collect nose and throat specimens for lab analysis. They did field investigations, which showed them who was infected, when they became sick, where they had been just before they got sick, and ultimately led them to that possible source. Now, CDC keeps track of the COVID-19 cases and collects information from surveillance systems that report different kinds of data, such as the hospitalizations, the deaths, demographic information like age, race, ethnicity, sex, symptoms, and treatments. The one thing that we have not got a good tracking on is if somebody has already died at home, usually the cause of death is, let's say, a heart attack, but they're not going to say that the person had COVID-19. They'll say he died of a heart attack. So that's why the number of cases is still underrepresented. Studying disease, the CDC scientists use this data including information from antibody testing and other kinds of studies to find out more about the disease, such as how long somebody is contagious, the risk factors for severe illness, and which medical treatments are most effective. Developing the guidance. Using study findings, case counts, and surveillance, CDC publishes resources to help people in different risk groups, like our first line healthcare workers and our older people. Help them to stay safe in their different settings like grocery stores, your home, or school. This guidance is consistently being updated as new information becomes available. And I'm telling you, in order to prepare for today's presentation, I've had to update this presentation daily because things keep updating daily. So that by the time this gets posted on your website for use, it'll already be old because there'll be new guidance given and they'll be moving forward. So that's why you have to keep up on what the science and the experts are saying. The spreading of the virus. I'm telling you people, I'm telling you ministers, this virus spreads easily between people. It is no joke. The virus spreads from person to person, and how it spreads, it varies. I could be sitting here with you with COVID and spreading it. I could have on a mask, take off my mask, I could spread it. I could be in your presence for 24 hours and spread it. Some viruses are highly contagious like measles, while other viruses don't spread as easily. Another factor is whether the spread is sustained, which means it goes from person to person without stopping. We're still studying these things. The virus is thought mainly to go from person to person between people who are in close contact with each other, about 6 feet of distance. And you've heard this 6 feet social distancing. And social distancing means just staying 6 feet away from somebody. And they're spread through respiratory droplets. That's the droplets coming from your nose when you cough, when you sneeze, or when you talk. Think about just talking and put your hand in front of your face while you're talking. And some of us, especially if you're preaching hard and heavy, you're going to be spewing out of your mouth. While you're spewing the word of God out of your mouth, you'll be spewing droplets and particles. That's why it's important that if you're preaching and speaking, nobody is less than 6 feet in front of you, because those droplets from your talking can spread. Just think of what a cough or a sneeze will do. These droplets can land in the mouths or noses of people nearby, or possibly inhaled in the lungs. COVID-19 may be spread by people who are not even showing symptoms. So it's not about people who have symptoms that you should worry about. It's people who don't have the symptoms. It may be possible that a person can get COVID-19 by touching a surface or an object that has the virus on it, and then touching their mouth, their nose, and possibly their eyes. This is not thought to be the main way the virus spread, but we're still learning about how this virus spreads. At this time, you cannot get it from animals. So let's be clear, your pet, your dog, President Brown, if your dog, you can't get COVID-19 from your big dog, so don't worry about it. Don't worry about anybody petting the big dog. You might get bit, but you're not going to get COVID-19. It appears that the virus causes COVID-19 can spread from people to animals in some situations. So CDC is aware of a small number of pets, including cats and dogs, a small number. So let's not go out there and spread rumors that people are giving it to their pets. It's only a small number. Immunity. We've heard a lot in the news lately, especially from our president, about being immune. Well, scientists have been working hard to understand this pandemic, but there's still a lot they don't know about immunity after recovery and how long this immunity lasts. Immunity means that, the longer your immune responses are associated with more serious illnesses. So the more serious you've had COVID, like been on a respirator in a hospital for 30 or more days, once you get over the virus, your immune response should be longer, but we still don't know how long this immune response is. Immunity means that you're thought to not be able to get the disease again. And let me put in there, you are thought to not be able to get the disease again. There's no standard time frame for how long somebody has immunity, and that's what the experts say. Those have recovered have been said to be protected for at least 4 months, but the time can vary. But there have been 3 cases of reinfection to date. So people who said, I had the virus, I got over the virus, I'm out of the hospital, I'm doing well. 3 people have been reinfected to date. So it's important to know that you can brag about immunity, but be careful. History can repeat itself with its disease. Vaccines. We've heard a lot about vaccines. And let me tell you, for religious reason, there are people who don't get vaccinated for basic things like measles and mumps and rubella, which as a public health expert, and I've been in public health for over 40 years, there is no way I would tell people not to get vaccinated. You can uphold your religious principles, but if there's a chance that you're not going to get a disease as common as measles, mumps, and rubella, have your children vaccinated. It's extremely important for them to be vaccinated. And we need to understand vaccines. I know a lot of our people, our Black people, have listened about the Tuskegee experiments that had happened back in the mid 1900s, and the Tuskegee experiments that had been done illegally on our Black men. And these types of experiments are no longer in effect. Their reparations had been made for the Tuskegee incident by, I do believe, President Clinton. Don't quote me, but I think that, or President Obama, one of the two of them had made reparations for it. But Tuskegee is no longer an issue with vaccinations. Many vaccines are being developed and tested, and some might be ready before others. CDC is planning for these possibilities. Every day we hear in the news about different companies having these vaccines ready, but they have to be tested, and they have to be tested on humans. These are not vaccines that can be tested on guinea pigs and rats. They have to be tested on humans in order to know their efficacy. At least these vaccines will be used for emergency use when they come out. We do believe that the emergency workers in hospitals and clinics and nursing homes will be the first people who will probably get it. There may be a limited supply of vaccines available before the end of 2020. The story keeps changing every day, but the supply will continually increase in weeks and months to follow. So don't panic. We want you to get a vaccine. It will become available for everybody, but if there's a limited supply, some groups may be recommended to get the vaccine first. It doesn't mean that you won't be able to get it. I just found out as of this morning that states and territories filed their COVID-19 vaccine distribution plans with the CDC last week. What that means is that your state health departments and the territories of Puerto Rico and the Virgin Islands had to file a vaccine distribution plan with CDC. This should be public information, and you should be going to your public health experts in your towns and your states to find out what is their distribution plan. Are they planning to distribute it, the vaccine, once it's approved, to the hospital workers first? Are they doing it? Are they doing the garbage collectors? They're first line responders out there. Has anybody thought about them? Are they going to the nursing homes first? But they filed their vaccine distribution plans already, and you have a right to know. The flu season is up, and they're already giving out flu vaccines. And if you're 60 and older or have any kind of compromised situation going on with your body, you have asthma, heart disease, diabetes, you should have already had your flu shot. It's not too late to go to the flu shot. I know that places like pharmacies like CVS, Walgreens, I don't know what's in your local area, even Costco and Sam's Club, they're giving flu vaccines. Go get your flu vaccine. Your insurance should cover it. If not, you might have a small copay, or a maximum you'll pay $20, but it's worth it not to get the flu this fall and winter. And we don't know what's going to happen this fall and winter. CDC believes that it's likely that the flu and the virus that caused COVID-19 will both be spreading. So if you get a flu vaccine, at least you won't have to worry about the flu as well as the COVID-19 attacking you and your body. During the last flu season, only 63% of children and 43% of adults received a flu vaccine. This is ridiculous. We know that the vaccine has been available and that people should be taking it. Why they're not getting the flu vaccine, we don't know. Coverage is especially inadequate for certain racial ethnic groups who are also disproportionately affected by COVID-19. And that is Black and brown people. We are more at risk. And as I go further in my presentation, we'll find out why. Let's look at some of the symptoms of COVID-19. These symptoms appear 2 to 14 days after exposure. Fever or chills, a cough, and not just a little cough, but a cough, a down hard cough, being short of breath or having difficulty breathing, being extremely fatigued, muscle aches, body aches, a wicked headache. The new one is the loss of taste or the loss of smell, having a sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. And these symptoms are some of the symptoms are the flu as well. The only way you'll know the difference between the flu and COVID-19 is if you have been tested. And let me tell you, you can go to be tested for COVID-19 in so many locations. Local health departments, they have a plan for where you can get tested, and most testing is free. Don't tell them that you have to have symptoms in order to be tested, because people with no symptoms can have the disease, and therefore it's important for you to be tested. Tell them, I want to be tested for COVID-19, and get tested today. I went to Florida for my birthday. My birthday was October 6th. Yay for me. I have to celebrate me all month, so y'all just forgive me. But I went to Florida for a week, my husband and I. And of course, you know, Florida is one of the hotbeds of the disease. We wore our mask the entire time, but we walked around and saw these silly people walking around with no masks on, not social distancing, being close to each other. But we acted responsibly while we were there. We did enjoy ourselves. We took off our mask when we ate, and we acted responsibly. But 5 days after we got back, we were tested. So last Friday, we were tested for COVID-19. I got my results back on Tuesday, and I am COVID free. So that's one of the things. You get tested, and within 5 days, you should know if you have the disease. Look for emergency warning signs for COVID. If somebody around you has trouble breathing, has persistent pain or pressure in their chest, has new confusion that's not associated with dementia or any other, or low blood sugar with diabetes, if they have an inability to wake or stay awoke, and if their lips are bluish or their face starts looking blue, dial 911. Don't try to do anything. Dial 911. These are severe symptoms, and they can come on at any time. You just need to be aware of these things. So let's do a quick little recap. I've got our female doctor up there, our female Black doctor, our female young Black doctor, because I support Black people getting into public health and medicine, and I support young men and women of color to get into it. COVID-19 is spread mainly through close contact from person to person. Some people without symptoms may be able to spread the virus. And while we're still learning about how the virus spreads and the severity of the illness that it causes, you need to be on the know every day. And what's new from CDC, which just came out this week, is that 15 minutes of contact over a 24-hour period with a person with COVID-19, you can get the disease. Now let's see what that means. Let's say for Thanksgiving, somebody is visiting and staying at my house. I spent 5 minutes with them in the morning at breakfast. I spent 5 minutes with them at lunch. I spent 5 minutes with them at dinner. They had the disease. That means I've had 15 minutes of contact with them over a 24-hour period, and I could have COVID-19. This is the new release from CDC. So it doesn't mean that it's just 15, I'm in your presence for 15 minutes, you have COVID-19 and you get the disease, but in your presence for over a 24-hour period for 15 minutes. Think about that. Think about the time you spend in classes, or think about the time that you spend with people, or think of the time you spend in a restaurant. 15 minutes over a 24-hour period. That is the newest CDC release. So let's go through this little triage. Main good social distance, about 6 feet. This is extremely important in preventing the spread. Wash your hands. I know when you go to the bathroom, some certain populations may not wash their hands when they go to the restroom. Wash your hands. Use soap and water. Wash your hands and keep them very soapy, and do it for about 20 to 40 seconds. Use hand sanitizer that contains at least 60% alcohol. Routinely and clean, disinfect surfaces that you touch, your desk, your computer, your telephone, your cell phone. Clean these things, and don't share your personal objects. Don't share your telephone, your cell phone with somebody. You don't know if they've got the disease. Cover your nose and mouth with a mask when you're around others. And it's important. I should have had my mask. I forgot to use my prop. But when you put your mask on, don't just cover your mouth, but you have to cover your nose. So the way this paper towel looks, this is how you should be wearing your mask. Not like this, because you can inhale droplets and sprays from people if you're not totally protected. Learn more about what you can do to protect yourself and others. And I strongly, strongly, strongly encourage you to be tested. Matter of fact, if you're not doing anything this afternoon, I encourage you to go through one of the drive-by or drop-through testing centers in your area. Let's look at COVID-19 and race. I like looking at our young STEM participant because we need to get more of our young children involved in health and health-related issues. Black individuals account for 13% of the US population, but 20% of the known COVID-related deaths where race is known. So in those deaths where race is known, 22% have been Black. This means that Black people are dying from COVID-19 at a rate of 2.4% higher than white people. Latino and African American residents have been 3 times likely to be infected than their white neighbors. And we're going to find out why brown and Black people have been 3 times as likely to become infected. And according to new data, which provides characteristics, 640,000 infections have been detected in nearly 1,000 US counties. 1,000 US counties, and Black and Latinos have been twice as likely to die. Let's think about that. Why are we dying twice as likely than white people? And it seems like that's what's happening with most diseases. Every time there's a disease out, Black people are adversely affected. And you keep hearing it on the news, but are we doing anything about it? And as the Black church, we have to understand these things and work hard to preserve our people's health. You're not just ministering to the spirits and the souls of these people, but you also are responsible for maintaining the health and the good health of our Black and brown people. Let's look at systemic racism. It has now become a public health crisis. It's not just that Mr. Floyd, Breonna Taylor, and so many others have died from police brutality and these systemic racism issues. We need to define this issue and figure out what the heck is happening, because our people are dying in more ways, but racism has an impact on COVID-19. And you have to understand this. This is extremely important to the Black church. Systemic racism is the way policies and practices of organizations or systems advantage some populations while disadvantaging others, creating different outcomes for different racial groups. That's the definition of systemic racism. And you're hearing this in the news often these days. Among Black Americans, systemic racism has led to longstanding inequities and striking disparities linked to COVID-19. What makes the Black community more at risk for COVID-19? Well, we have higher rates of pre-existing conditions, heart disease and diabetes and asthma. We are overrepresented in frontline and essential worker jobs. We're doing the hotel work. We're cleaning the hospitals. We're cleaning the nursing homes. We're working in hospitals and nursing homes and working in restaurants. So we are doing these menial jobs and laborer jobs. We're the garbage collectors. We are these frontline workers. There is unequal access to quality health care and insurance coverage. No matter what's happening with the Affordable Care Act and commonly called Obamacare, a lot of us are still uninsured or underinsured and have access to quality health care, especially those living in rural areas. Sometimes the hospital is 50 to 100 miles away in rural areas, and a health clinic is even as far or farther. And we're more likely to live in hyper-segregated neighborhoods. That means that we're just living with our people. You've seen the issue of railroad tracks. They said you find a railroad tracks and that's where you're going to find most Black people, which stems back from how we were transported and we made it through from the south to the north. We're living around railroad tracks. Well, we're hyper segregated in neighborhoods. Look for a Black college, there'll be a railroad track. Please tell me if there's a railroad track near Payne and there's a lot of Black people living near the university. It's been around since 1894, I believe. You look and see if there's hyper segregated neighborhoods, if Black people live around the university. Long-standing inequities caused by systemic racism exacerbate health impacts. Food insecurity. I have to stress, our people are hungry. With the loss of jobs due to COVID-19, we had food insecurity before then. We have had a lack of good supermarkets in some areas. That's what food insecurity is called. You have little corner stores that don't have fresh fruits and vegetables. When you go to the stores, you can pay $1 for a bag of potato chips, but you might pay $3 for a tomato. So it's cheaper to get a bag of potato chips than it is to get something that's healthy for you. Well, Black people are more than 2 times more likely to face hunger than white people. Housing insecurity. We have a large homeless population, especially with COVID-19. People have not been able to pay their rent for the past 6 or 7 months because they don't have a job. We make up 40% of the homeless population. This puts us more at risk for COVID-19. Let's look at wealth. The net worth of a typical white family is 10 times greater than that of a Black family. That's a shame. We are so poor, 10 times greater. Look at the wealth range. Education. 40% of Black students receive a 4-year degree as compared to 64% of white students. And mass incarceration, we don't even have to talk about that, but we're incarcerated 5 times the rate of white Americans. Single Black women say, what can I do to find a husband? Go to jail, because that's where they are. All the they keep incarcerated Black men, and we're incarcerated 5 times the rate of white Americans. These are the long-standing inequities caused by systemic racism. If we want to have a lasting change to address this problem, 1, we have to dismantle the structures that support racism. And some of these are our institutions of higher learning. Some of our institutions of higher learning. When I went to Harvard, The professor in my one course that I had to graduate from in my major, and it was, one of those, you pass it or you fail it. He said to me, Miss Sammons, we let you in, but we don't have to let you out. If you fail this exam and you fail my class, you won't get your degree. That's systemic racism. That was overt racism. But because it was a discussion between he and I didn't have any proof. But that was part of the system of racism at Harvard. And they finally hired somebody who deals with equity and diversity at Harvard because of all these major issues of structural racism. We have to dismantle these things. And even in healthcare, there's structural racism. Whereas if you're poor and Black, we'll let you sit in the waiting room of a hospital. But if you're white and you're bleeding, we'll take care of you first. We have to deconstruct systems that contribute to wealth inequality. Looking at the types of jobs that are offered, you look at the percentage of people that are CEOs in company that receive big corporate paychecks or receive the top percentage of jobs in our country. They mainly go to white people. Well, we have to deconstruct these systems that contribute to this wealth inequality that leads to us not being able to get a decent amount of money. We have to look at fair labor and fair wages. Oh, yes, ministers need to be on the forefront of preaching for higher cost of living. That's something that we need to really push for. How do you expect a good tithes and offerings support your church when people aren't even making a decent living? Our tithes and offerings support the church. So if you're not making a decent living, 10% of $1 is 10 cents. 10% of $100 is $10. But looking at 10% of $100,000 is how much? Is that $1,000? Yes, Mr. Kim, I see you doing the calculations. $100,000 can bring you more to your church than somebody who's making $10,000 a year. But we want all people, but we have to deconstruct these systems that contribute to wealth and inequality. Thirdly, we have to expand health coverage and access. There is no excuse that in 2020 that all of the people in the United States are not covered with health care. It should be a right given to each and every person in our state, in our country. Canada has universal health coverage for every person in Canada. Why can't we do it? We are one of the wealthiest countries in the world. There is no excuse for it, but it keeps us poor. It keeps us sick. It keeps us unhealthy. It keeps the foot on our necks. And you have to see the foot on our necks is more than just police brutality. It's us being held down with poor incomes and lack of health coverage. Fourth, we need to address the social determinants of health. And what are these? Food, housing, and education. Those are the social determinants of health are your basic needs, things that keep you going from day to day. We have to address these issues. So addressing systemic racism means not only equality, but equity and justice. Have you seen this example before? I want you to look carefully at the first example, equality. This is the assumption is that everyone benefits from the same supports. Everyone, I wish I had a little, I don't know if you can see my little cursor, but everyone has a box, which it means everybody has the opportunity to see the soccer match. However, the little short fellow can't see it. He's got equal representation. He's got a box, but the tall person definitely sees the game. The medium-sized person, it can see the game, but the poor little short person can't see it. Equity means everyone gets the support they need. So that's the concept of affirmative action. So you give the little short fella, vertically challenged, you give him 2 boxes. So now he can see. You give the other person that 1 box, and the tall person can still make it on their own. That's equity. Everybody can now see the game. But let's look at justice. And that's important. All 3 can say the game without any supports or any accommodations, because the cause of the inequity was addressed. The systemic barrier was removed. That barrier was that fence that you could not see through. This is what we need to think about when we're looking at systemic racism and how we're looking at COVID-19 and everything else that disproportionately affects our communities. We've had the fence up too long. We haven't had a box to look over the fence. When we have, the boxes haven't been equitably distributed. And if we can just get a fence that we can see through, we can look at the game for ourselves. Stress. Oh my Lord. And don't tell me that you aren't stressed. Black people have been stressed because racism is now a basic stressor. Racism can harm your health. What does this have to do with COVID-19? Many of the factors believed to contribute to the high rates of infection in communities of color can be traced back to these structural inequities. A long history of discrimination in education, housing, and the workplace mean Black Americans are more likely to live in more densely populated areas and work in lower paying jobs that are now deemed essential. I think before the COVID-19, the menial jobs that we had, they were just there. You know, you people work for us, you just around. But now we're deemed essential workers, but they're not giving us any essential pay. They're just calling us essential workers. This means that both highly daily exposure to the virus and a lower possibility for social distancing at home or at work are there. Sometimes in these areas where you're working in kitchens, think about working in cafeterias. You're around these people very closely. You can't social distance when you're working right next to somebody. Working in a factory, sometimes you have to work right next to somebody. You can't social distance. This goes back to mask wearing gloves, trying to limit your exposure as much as possible. And are the people that we're working for, we have to hold them accountable for making these things available to us. Are they providing masks for us, PPEs, you know, these essential equipment to keep us from risking ourselves of exposure? Being stressed out because we don't have enough education to get a higher paying job. Being stressed out because we don't have enough income to give us a decent house in a nice area. The stress that we have just by being Black. Being a Black man, Mr. King, as clean cut as you look, if you're standing in an elevator and a white woman gets on, what's she going to do? She's going to back up. She is not going to get on the elevator with you. That's how the Tulsa race riots got started, because of a Black man and a white woman on an elevator, and she claimed that he raped her. This kind of systemic racism still exists. It didn't go away. It doesn't go away because a Black man has on a suit and tie. White woman still holds her pocketbook close to her if a Black person comes anywhere near her. And just think about it. Now that we're wearing masks, do you think that white people are less afraid of us? Dealing with racism, we're even more afraid of each other now that we're wearing masks. Look at a young Black man with a hoodie and a mask on. We're getting stressed out wondering, is our young Black brother and sister gonna rob us? Now think about it. If you've never thought that yourself, praise God and I appreciate it. But tell the truth and shame the devil. I'm sure that some of you all have thought about a young Black man in a hoodie with a mask on, possibly assaulting you, harming you, or robbing you. That's what white people are thinking, and that's stress and racism. Okay, I'll get off that soapbox just for a hot second. We're going to talk about COVID-19 and comorbid conditions. I'm trying to define a lot of these terms and words for you because you hear them a lot on TV, but they don't explain them to you. They just spout these words and you don't know what these words mean. Comorbid conditions are certain underlying medical conditions, and adults of any age are at increased risk of getting COVID-19 from these diseases. Cancer. Cancer isn't just one disease, but it's many diseases. You have breast cancer, cervical cancer, prostate cancer, lung cancer, blood cancer, childhood cancer. So there are many types of cancers, but cancer as a disease as a whole. Chronic kidney disease, people on dialysis, they have to go to dialysis 3 times a week, which means 3 times a week they're going out of their house, exposing themselves to coronavirus. COPD, I know you've seen the commercials for the drugs that handle COPD. That's chronic obstructive pulmonary disease. Those are lung diseases. Heart conditions such as heart failure, coronary artery disease, and cardiomyopathies. These are things that people have that have been caused by high blood pressure. For those who have high blood pressure, if you're not taking your high blood medication, shame on you, because if you don't, that can lead to chronic kidney disease. I have a brother, the one I visited in Florida. He wasn't taking his high blood pressure medication because it has an adverse effect on sexual functioning. Yes, Black men, high blood pressure medication and diabetes medication can affect you sexually. So he wasn't taking his medication regularly. Well, guess what? He is now on dialysis, having to wait for a transplant just because he didn't take his medication. Black men, I'm going to preach to you because you are the ones that are hard-headed and a soft behind. That's what my mama said. And you got to make sure you take your medications and you got to see your doctors. We as Black women, we support you. We love you dearly. We try to get you there, but you think that we're nagging you or getting on your case or whatever you want to call it, but we just want to keep you around. There are so few good Black men to go around. We just want to keep you here a little bit longer. Say amen, somebody. Let the church say amen. Let me get on with that. People who have immunocompromised state or a weakened immune system, those are people that have HIV or have any other kind of immune disease like sickle cell. Think about the Black people with sickle cell anemia. Those are compromised immune systems, or people who have had an organ transplant. Obesity. Let's be real. Some of us have put on some pounds since COVID. I call my little pooch a COVID baby. My husband says, don't call it a COVID baby, honey. You just put on a few pounds. But all of us have put on a few extra pounds during this pandemic. But the body mass index of 30 kilograms or higher, or less than 40 kilograms of body weight, is being obese. Guess what, people? Most of the Black preachers that are out there have been eating too much fried chicken and macaroni and cheese and sitting around reading the Bible and doing their studies and not doing any exercise. I have to say, my pastor runs 5 to 10 miles every day. He runs marathons. He just turned 60. I think he's turning 61 next month. And he's an avid runner and he eats healthy. We no longer have fried chicken dinners at our church. Whatever we have, it has healthy eating. We no longer have donut Sundays after Sunday school. So we've stopped doing those things to help make a healthy congregation. Look at severe obesity. Those are some people, it's difficult for them to walk, difficult for them to breathe, difficult for them to stand. Severe obesity, that's greater than 40 kilograms of body mass. Sickle cell disease again, smoking. Oh, I can't get on you hard enough. Smoking is one of those preventable things that you can do to keep yourselves around a little longer. Don't say that my nerves make me smoke a little bit more. Get a patch, go get one of these online courses that help smoking cessation. Do something to stop smoking because it can prevent things like cancer. It can prevent cancer, heart disease, obstructive pulmonary disease. Smoking has a cause for each one of these diseases. And type 2 diabetes. I can't stress how diet and exercise play into type 2 diabetes and taking your insulin as directed by your doctor. Our Black people, all of these underlying conditions, we are adversely affected by these diseases. All of you who have prayer sessions for your congregations, you're praying for Aunt so-and-so who's got diabetes or who has cancer. I don't think there's one of these diseases that you haven't prayed for somebody in your midst that has had these diseases. I just have to keep stressing these. Comorbid conditions. Now, having these diseases at the same time, comorbid. Having heart disease and diabetes. These are two cousins that often go together in the same person. You have high blood pressure and diabetes, even though high blood pressure can lead to diabetes. You have obesity and heart disease. You have obesity and diabetes. Obesity can lead to heart disease and it can lead to diabetes. Cancer again, a sedentary lifestyle. That means you're sitting around on your rump. You're not doing anything. You're sitting around on these Zoom meetings. You're sitting around doing lectures and things. You're not getting out there exercising. You're not having an hour's worth of exercise every day. You're not taking a half hour to go out there and smell the wonderful fall air. And poor nutrition sources and poor nutrition choices. It's one thing to be able to afford fresh fruits and vegetables and healthy lean meats, but not being able to have them, not being able to afford, healthy fresh fruits and vegetables or to make those choices. But each one of these, when they're in combination with each other, is a comorbid condition. So if you have heart disease and a sedentary lifestyle, that is comorbid and that puts you more at risk for COVID-19. Do I have to preach this from the mountaintop like Dr. King? I hope it gets to you. Mental health. That's something that Black people don't talk about because if I pray it away, if I just ask the Lord, it'll just go away. I don't have any problems. I don't have any worries. I don't worry. I don't have stress. I'm too blessed to be stressed. If I hear I'm too blessed to be stressed one more time, I'm gonna have to slap somebody. Too blessed to be stressed. That's so not true. I love the song, "Take Your Burdens to the Lord and Leave It There." We're telling people, come to the altar, leave your prayers there, leave your problems there, and go home refreshed, and your burdens won't be there. But all too often, we do take our burdens right back home with us. Matter of fact, we take it right back to our pew, to our seat. We hadn't even gotten out to church good before we're thinking about these things again. So mental health is extremely important. Right now, we have children who are unable to physically attend school. They're missing school lunch. So what are they eating at home? If they were poor enough to qualify for school lunch, then they're not going to get any more lunches at home. This is leading to poor mental health outcomes for these children. And they're worried. They can't do their homework with a hungry, growling, empty stomach. What about recess? They were getting exercise at recess, but now they're not having recess. If they're being homeschooled, are the parents taking a break for recess and going out and exercising with the children? That's something to think about. Adults who don't have jobs, they are stressed out, and you can't tell me that they're just praying away this issue of not having a job. They're sitting online, applying for jobs. They're doing whatever they can to get a job, and they are stressed out. They're at home. They're trying to educate their children at home. They're trying to do whatever they can to put food on a table. They are overstressed. Church members who can no longer attend church physically. I went through church withdrawal. Oh my goodness. The first Sunday when COVID-19 regulations came out and said, you are no longer able to congregate, period. It wasn't about 10 people, 50 people, no people. I said, what am I going to do without my pastor? What am I going to do without my hugs and my kisses every Sunday and being able to sing in the choir? Oh my God, I love singing in the choir. That's one of my ministries. I can't do that. Think about the church members. Think about Miss Sally. Think about the old members of the church, the mothers of the church who can no longer physically attend church. That was their means of social integration with people. They were able to see younger people. They were able to be mentors to people. They are going through a mental health crisis now that they're home, and a lot of them are home alone because they're living independently in senior living establishments, or they've been blessed enough to be able to be in their own home. So they are socially isolated. Have you called them lately? Have you checked on them lately? Is there a calling tree where you go through and you call to older members on a daily basis, where different people call them just to check to see how they are, or dropping something off to them, or going to the store for them? The mental health outcomes for them can be so differently if we would just do something for somebody else. These elderly can no longer go to their adult daycare programs. They were getting a meal at these programs, and they were able to play card games and be able to watch TV with other people and have conversations. And think about the adults who now have to work from home. I'm blessed where I work from home and go into the office 2 days a week. I am blessed to work from home, but it's stressful having to get up in the morning, even though I can work in my fuzzy slippers. And I'm telling you right now, I'm dressed up, but I have my fuzzy slippers on. So I'm telling the truth right now. I am not putting on tight shoes. That's one of the benefits of working from home. But it's a stress working from home. You have to make sure that your surroundings are made out just like your office. I carry a rolling suitcase to work every day so I can carry what I need home when I'm working from home. That's stressful. And what if I don't have some of the tools that I need? What if the internet goes out? What if I can't afford to pay for the internet and I have to work from home and use the internet? Do you not think that I would be stressed out? All of these things, and I'm sure that you could list others that deal to a declining mental health among our people. And think about people who don't have access to internet because they live rurally, or they don't have access to iPads so that their children can learn from home. Or think about those parents who are working from home and have to homeschool their children. I don't know how they do it. They should get medals. They should get awards. They should get congressional medals, because trying to do both of those at one time is extremely difficult. There's a new study by Robert Wood Johnson Foundation that shows more than 1 in 7 young people in the United States have obesity, which can increase their risk from severe illness from COVID-19. We have to think about our children that are not getting out for recess now, and they are obese. We have little mini sumo wrestlers, as I call them. There's some little 2-year-olds that have high blood pressure because they're eating all the wrong things and not getting exercise. We have to worry about and care for our children. It's our responsibility, the church's responsibility, to care for children. And what are we doing about these children with obesity? Children are getting COVID-19, and I'm telling you right now, they don't get the symptoms often. But what happens is these children go out and bring the disease home to their parents and to their grandparents. So the lack of symptoms in our wonderfully young children, they come home, the first thing they do is give mommy, daddy, grandmom, grandpop a hug. Where have they been all day? Have they worn their masks? And are they bringing home the silent symptoms of COVID-19? Let's think about our children. Okay, mental health problems are common. So here are ways to cope with stress and promote well-being. People, we got to pause. Pause, breathe, inhale. Do it with me. Inhale. Take a deep breath and exhale. How do you feel? How do you feel when you pause and you breathe and you exhale? That's important for those of us who are providing the religious experiences for our people. Sometimes we have to stop, pause, and breathe. We take the burdens of the church upon ourselves. And at times we have mental health crises, which only our prayer partner and the good Lord know about, because we're too proud to tell somebody else that we're having a mental health crisis. Preachers commit suicide too. So you have to understand that suicide in the Black church is rampant. I preached on that back in September during Suicide Prevention Week, and we do commit suicide in the Black church. So we need to pause and breathe. We need to take breaks from upsetting content. I know if you watch the TV, they keep breaking in with recent break-ins about the coronavirus, or what number 45 in the White House is doing, or what people are doing rioting, all of this kind of stuff, and issues that are happening abroad. All of these things are upsetting content. Sometimes we need to shut it down, take a break from the TV, not watch it. Say I'm going to watch the evening news, or say I'm going to watch CNN at 5 o'clock in the afternoon, but take breaks from these things. You need to take care of your body. That's called well care. You need to eat well and exercise. I'm preaching to myself, but I'm eating more salads, more fruits and vegetables, trying to get up and walk in the mornings. But those are things that we need to do. How can you preach it if you don't practice it? Think about that. And how can you tell it to your congregation without feeling guilty if you're not doing it yourself? Reach out and stay connected. That's what I'm talking about, calling trees. There should be a list of people that you should be calling on a weekly basis, some on a daily basis. Some people need that daily touch, but you need to reach out and stay connected. Don't stay in isolation. When you stay in isolation, that's when the mental health problems are promoted. So don't stay in your little bubble. Literally, you need to stay connected. And finally, seek help if you're overwhelmed or if you feel unsafe. It's important. I have a therapist. I love my therapist. I talk to her once a month. I'm serious. Sometimes you just need to talk to somebody about the issues that surround you. I talk to God every day, several times a day, but my therapist is there to help work through some of these issues that maybe I don't feel like I've gotten the answer to, that I already got the answer to, that I haven't acknowledged that I got the answer from God already. But having somebody to help me from feeling overwhelmed and that unsafe feeling. We do have children who are living in domestic violence situations. We have women who are living in homes with domestic violence. These things have escalated during the pandemic, and kids have been safe at school from the domestic violence and abuse that they faced at home because they've been at school. But now they're at home and they're seeing it. It's live and in living color. We need to get help for them. That's a whole nother discussion. When I prepared this, I said, what can I leave out? I really can't leave anything out because it all affects the Black church. But if you're overwhelmed or feel unsafe, you need to seek help. But my brothers and my sisters, pause and breathe. You can't help anybody if you can't help yourself. What can you do to maintain your regular screenings? Oh, you need regular blood pressure checks. I know with telemedicine now, they have blood pressure cuffs that you take your blood pressure and it goes straight to your doctor's office. Matter of fact, I have one of those kits now. It was sent by my doctor because I'm over years old, and they provide those things to people of a certain age. And so they sent a scale. Oh my God, the scale, when I step on it, my weight goes directly to my doctor. Boy, you thought you could lie before, or you could do something to get your weight down before you go to your doctor visit. Oh no, it goes to them directly these days. But having blood pressure checks, there are still places where you can get your blood pressure checked. Your diabetes, if you have diabetes, you need to know, you need to check your diabetes, your sugar, as they call it, several times a day. So don't skip it. Do your checks, prick your finger and take your blood, find out what your blood sugar is, take your medication if you're on medication, and watch your diet. Dialysis, if you're on dialysis, don't be scared to go out. Put your mask on and put your gloves on so you don't touch things. Go out for your dialysis appointments. Mammograms, breast cancer exams. I'm a breast cancer survivor, and October is Breast Cancer Awareness Month. And I have to tell you that women have not been going out for their breast cancer exams because of COVID. You can't catch COVID getting your breast cancer exam. Those facilities are clean and sterilized. I have my appointment scheduled for next month. They couldn't fit me in the month of October. One way to remember when to get your exams for prostate and breast cancer is to schedule it in the month of your birthday. I schedule all my health appointments in the month of October for my birthday, so I don't forget. So I have my breast cancer mammogram scheduled. And I had my regular well patient checkup in the month of October. So everything's on track. Prostate cancer exams. Black men, I'm going to get on you. If you are 40 years and older, Mr. Kim, you look like you might be 40, or the gray hair may have just come out because you might have been stressed. But prostate cancer exams are important. I keep telling Black men, you are not going to become gay just by getting a prostate cancer exam. A digital rectal exam shows how your prostate is, to see if it's been enlarged, to see if it's grown since the last time you've been there for your appointment. And a simple blood test will tell if your prostate specific antigen or the antibodies in your blood have increased. That he had a very aggressive kind of prostate cancer, which if he hadn't been operated on, he would have died. So think about it. Get your prostate cancer exams once a year, mammograms once a year. We now have telemedicine check-ins with our doctors because doctors don't want you to come into their offices. So use your Zoom with your doctor. Talk to them as if you were talking directly in their face, because you are. Tell them what's bothering you. Get your medications refilled. This is important. Don't go without your medicines. And some people don't have a job. If you go without your medicines, your blood pressure will increase, your diabetes will get worse, your cancers will get worse. Sometimes there's pharmaceutical firms that have free programs for people who cannot afford their medications. Your doctor should know about these free medication outlets for you. They may even have free samples that they can get to you. And well child checkups. It's important that our children have their well child checkups annually, because they can go with undiagnosed diseases, especially, I told you about the RWJ study with children getting obesity. Well, it's even more important for them to have their annual well child checkups. What do I do about seeing a doctor? If you're having a crisis, emergency rooms are now the safest place to go. People had not been showing up at emergency rooms because they were afraid that they would catch COVID-19, but they are, I would say they're very well isolated. People aren't even going to emergency rooms anymore. So they're the safest places to go if you're in some kind of medical crisis. Again, most doctors are doing telemedicine. Large clinics have been downsized, but they're still holding patient sessions. And I'm stressing regular screening for disease. You have to have your regular screenings. And you have to stress this with your people, your peers, your family members. Get on your family members. You know you won't be able to get together for that big Thanksgiving congregational reunion, but you talk to them on the phone. Ask your brother or your cousin, have you had this appointment? Have you taken care of this? Are you taking care of that? We are our brother's keeper. So let's get into how we live. That's my pastor. That's Pastor Davis. That was a Saturday evening worship, because we do have Saturday night worship. And one of our slogans for one of our years is Faith Strong. So we have our own t-shirts, our own masks for our church, and people mimic Faith Strong. That gets us out there to exercise. So African Americans, how do we live? Some have single parent homes. Some have had job losses or reductions in the amount of time that they can spend at their jobs. We talked about the comorbid conditions and obesity. We have a lot of African Americans who live in the rural areas, and a lot that are congregated in inner cities. We have grandparents raising grandchildren. We have people making choices between medication and food. Sometimes we have a lack of transportation, either because we're rural and we can't get to a store, or we can't get to a hospital, or we're inner city and we don't have money to get the bus or the metro system. A lack of broadband or internet access. Again, we talk about the racial discrimination that we face and the mental repression that we have, and the violence and the crime that we face, whether we're rural or we're inner city. Our Hispanic and Latino families. I've learned a lot since COVID about our brown brothers and sisters. They're multi-generational. They have several generations living in one household. Oftentimes, your grandmom and grandpop will live in the home with their children and their grandchildren. They have crowded living conditions. They have only a couple bedrooms with 2-3 generations living in the same household. They are unable to be socially distant. If you have a 2-bedroom apartment and you have 10 people living there, tell me how you can be socially distant, especially when that little child comes home from school, hugs grandma and grandpa, or one person in that household has COVID-19. How can they socially distance themselves from the other 9 people who don't? Their jobs are in the service industry. A lot of them took the jobs we were too proud to take. And now we're complaining about we don't have a job. Well, we were too proud to take those jobs. So our brown brothers and sisters have taken those jobs in the service industry. They are now more at risk. They don't have sick leave. Some of these jobs in hotels and factories or in cafeterias, they may not have sick leave or they may not have COVID-19 leave. They have to be out for a month. Well, you might as well say they're unemployed. They have comorbid conditions. They have the diabetes and the obesity and the heart disease along with this. The obesity is prevalent in a lot of Latino families. The elderly are important to their family. They have problems with literacy, understanding sometimes their own language in writing because they may be illiterate, and they have a problem with understanding English. And one other thing about their culture, when somebody is sick, family is supposed to be around them to help lift them up out of their illness. That is a cultural thing. So when I say culture promotes family when people are ill, this is what happens. So can you imagine one person having COVID-19 in that crowded house? People are culturally wanting to be around them to help them through this illness. Then the whole family gets sick. And then you have multiple people in that family dying of COVID-19. I just have to cover rural versus urban. And just while white residents make up nearly 80% of rural populations, as opposed to 58% of the urban populations, different racial and ethnic populations face unique health disparities within rural communities. We have a lot of isolation when we're in rural communities, and mostly our elderly are out there in rural. I think about rural Louisiana and the fact of the tropical storms that have devastated Louisiana and our Western states, how they've been affected, and how you have the elderly and they have children out there. They're unemployed, underemployed, uninsured. And these people are out there and they're still have to face COVID-19. But think about those in rural populations, not just our metropolitan African-American people. Here you can see that African-Americans make up a smaller piece of the pie than white people, of course, in our metropolitan and non-metropolitan areas. But here we are in our metro areas. We have more people in metro areas than we do in the rural areas. But we have to consider all of our people. What happens? We're looking at the social determinants for rural people. Think about having economic poverty and a lack of a vehicle to get to healthy food. Think about not being able to participate in SNAP benefits, supplemental nutrition programs. Think about the transfer of income. You know, you don't have much money coming in, but everything going out. These are compounding things on an economic basis, but demographically, you're living with a lot of minority people. You have a high elderly population. You've got those multi-generational subfamily households. You have that working age dependency. Somebody's got to make the money. You have a foreign-born population. Look at the educational levels of our people, the demographics, the fertility rate. People are still having babies in COVID. And I bet after all this social isolation, there's going to be a whole lot of COVID babies born next year. You watch my words for a spike in babies being born this time next year because of COVID-19. We should see a real increase in the spring from that 9-month period of babies being born. And we have to think about our veterans. We have a high veteran population that's been totally ignored. And Veterans Day is coming up on the 11th of November. Are you going to be doing anything to support the veterans? Are you going to be giving them a call? Are you going to be giving them, if they have Zoom, you're going to give them a Zoom call? Are you going to drop them by a care package to your veterans? They help keep us safe. So much for that precinct. let's talk a little bit about the forces of change. Engaging the problem. Dietitians have been working hard trying to get good standards for food packages for people, trying to figure out what a healthy diet is all about. So dietitians have been involved in COVID-19. Business people have been involved because businesses have been lost or people are going out of business. The researchers have been involved because they're trying to figure out what's going on with the disease. How can we keep the disease from going down? How can we develop vaccines? We've got stay-at-home moms and dads who are trying to take care of our children and trying to keep their jobs. And then we have logistic experts. How am I going to get my Amazon package? Yeah, confess. How many of y'all have a new relative in your house called Amazon? Amazon's delivered almost on a weekly or daily basis. Amazon is my friend. So we have these logistic experts. These people are engaged in affecting the change. But I want to add to it preachers. Because when I looked at these models, they had social workers and nurses and teachers, historians, political people, but they did not have preachers in affecting the change. They were absent from this. And we are a force to be reckoned with and a force of change. When your pastor talks to your congregation, people listen. They listen to what you say. The people who died from COVID-19 that had pastors talking about, oh, this is no problem, and spouting and preaching with no mask, they had throngs of their congregation die, and they died with them because they didn't speak science, they didn't speak truth, they didn't practice it, and they ended up dying, but they could have saved themselves and their congregations. So involving preachers in affecting change is important. Let's get back to worship. This is my church, First Baptist of Highland Park. What else could I use for an example? We seat about 1,000 people. And a lot of times I'm sitting up in the choir, so it's hard for me to get pictures of my pastor unless it's not my Sunday to sing. So I have to preach from behind him. But he does preach to the congregation. So all of y'all remember, please preach to the choir. Turn around and preach to the choir because we need the message too. Do we really need to reopen our churches? I'm hitting a sore thumb here with you all. So what do the experts say? Where you live, how many people are allowed to be in open spaces? Is it 10? Is it 50? Is it 100? How many people can congregate in one area? What is the COVID temperature of your community? What that means is, what is the rate of COVID exposure? Have you had an influx or a high number of people affected with the disease in your community? If you have, think about if you should open. And what does your congregation say? I know when we first closed the churches, everybody said, oh no, I got to go back to church. I got to go back to church. But what does your congregation say now that the disease is rampant? So what do you need to get started? The first thing is a survey of your membership. Send out a written survey by mail to your membership to see, one, do they want to come back to physical worship services? If they do, when do they want to come? If you've got more than one worship service, we have 5 services a week, one on Wednesday at noon, one on Wednesday at 7 p.m., one on Saturday p.m., one on Sunday at 7:45, and one on Sunday at 10:45. So we put a checkbox for all 5 services. Which one or ones would you come to if the church were open back up? What would make you feel safe coming back to our church? Would we have to have sanitizer and gloves for everybody or a mask? So survey your membership. Find out what they think before you open up the church. Don't be so fast to reopen without finding out what they think. And have a committee, a reopening committee that will work with you, of your deacons and your trustees and your ushers and people. The frontline workers are the ushers, the people that are involved in your worship. and see what they think about reopening church and what it would take to prepare to reopen. You need a waiver for visitors and members. You need a waiver form so that people, if they catch COVID while they're at your church for whatever reason, that they don't sue you because they caught COVID at your church. Let me stress again, people do sue churches. So you need a waiver for everybody to sign. And that includes the people who work for you. Every minister, security guards, no matter who it is who comes in contact with your church, they need to sign a waiver so that they will not sue you if they contract a disease. You have to have the ability to do temperature checks. We bought those little temperature check gauges, and everybody gets a temperature check when you come to the church, from the pastor on down, and you get them checked. If you go out, I sang for the early service Sunday and came back out, went and got my coffee. When I came back in, I had to have another temperature check, because no matter when you go out, you come back in and get your temperature check. Sanitizer stations, you need those all over the church. We had them before COVID, we had them. So people would wash their hands, have their hands disinfected to not spread disease and germs, because we had a public health perspective on our church because we have a health ministry. So sanitizer stations strategically located. You need social distance markers. Take that blue tape that you get from Home Depot and Lowe and put X's on the floor that are 6 feet apart. So when people come into the church, they have to be in line 6 feet apart when they're coming into the church, 6 feet apart when they're coming into the sanctuary, 6 feet apart wherever they're going, but they have those 6 feet markers on the floor. That blue tape is easily removable and won't harm your carpet or your floors. You need to have a sanitation team. I'm not just talking about the custodians, but a sanitation team, so that as the banisters and seats and things are being touched, that somebody's coming behind them after they're done to sanitize it, so that the next group that comes in is not being exposed. And you need PPE, personal protective equipment. Everybody needs a mask. Everybody who comes into the church or comes on the church campus needs to have a mask and have it on. We don't require wearing gloves, because let me tell you, with gloves, you touch a unclean surface with your gloves, and then you touch your nose, you're putting that unclean substance on you. So sometimes wearing gloves are more harm than good. So wearing gloves is a personal choice. I see people going out with Playtex rubber gloves, acting like they're getting ready to go out into battle. But however they have to do it to feel protected, float your boat and do it. But these are the things that you need to get started. Other things to consider. This is supposed to go from side to side. So safety, that's that waiver for COVID exposure. Your choirs, you can't have a choir anymore. People will be spitting all over each other. People were standing next to each other in 50 to 100 person choirs. The age of 50 and 100 person choirs are now over. You will now have an ensemble of 5 to 8 people. Get your strongest voices that are out there, so that you can have an alto, tenor, soprano, and bass. So you can have an ensemble that will lead your praise and worship. Offering basket, you can't pass the basket anymore. That's touching. You're touching going from one person to the other. So have e-giving through Givelify. There are many e-giving opportunities that we now have that you can give to the church, or have that secure box that you have there. You have the tithe and offering box that people can slip their offering in. I was one of those people that I'm giving my check in my envelope with my number on my envelope, and I'm only doing that. I did that until about 3 months into the virus, and I would make sure my envelope got to the church. And then I realized, they can still count your e-giving. So now I text my giving to my church, text my tithes. And that's such an easy process. And I still have a log of it. the length of service or the length of programs. You have to think about it. Sometimes we have 500 announcements in a program. You don't need all those announcements. We have other ways of getting announcements out to the people. You can use them on a video screen. So think about the length of a service. Seating. Our 1,000-seat capacity, if the government says you can only have 100 people, then we have to make sure that our seating is spaced out. We've put little X's with that blue tape on every 6 feet away. So we have a seat that's open 6 feet away. The seats have blue tape on them that you can't sit there. We even have aisles that are roped off so you won't have 6 feet between aisles of people. So you have to think about seating and spacing. You have to think about who's going to attend. Is it going to be first come, first serve? If it's open to 100 people, are 100 people going to come flocking in and the second 100 have to go home? Or are only about 10 people going to show up because they're really not certain about this disease yet? So think about who's going to attend. Communion. You cannot use that communion vessel anymore because somebody's got to pass that vessel to each person or to pass it down the line so the people will get their communion. You can't do that anymore. So now you have to think about the individual cups that they have. And maybe when you enter the church on Communion Sunday, as you come in and get your temperature checked, you pick up your individual communion cup and you've already got it so that when communion is ready to be served, then you'll have your communion cup there and ready. And bedside Baptist, not everybody's coming back to church. So you got to video stream your service. You have bedside Baptist with Pastor Pillow and Deacon Couch. So you do YouTube, Light Source, you do it on Facebook, but there are so many mediums where you can do your service. I look at Facebook. That's where I get my service video streamed, and I'm able to watch more services than I was able to physically attend. And I give it electronically. Your ministries, the missionaries, you can still use the ministries. The missionaries do food and clothes distribution. They can still do that during COVID, and it's even more necessary now. You have wellness ministries and nurses at your church. They can do the temperature checks, make them feel useful. That's something that they can do. Security, they can keep the peace and make sure that somebody's not going to get all fussy because you can only have 2 people in the elevator now, as opposed to everybody packing in. Your trustees and deacons and elders are your gatekeepers. You have new ways to give. So the trustees need to be sure that they know of the new ways to give and they can be able to tabulate your money that way. You got the custodians to keep the bathrooms and the seats and the doors, et cetera, to keep the sanitation team, to keep things clean. You've got administrative staff of the state of the church that have to keep those waivers and keep a listing. You don't put a waiver in every time you come to church. Your name gets put on a list so that they check your name off on that waiver listing. So then all you do is get your temperature checked and check your, have you been exposed lately? And the ushers, I don't care if that's your favorite seat. You've been sitting there every Sunday since hell froze over. Guess what? That seat is now one that has to be empty. So the usher has to keep that seat empty and keep Mother Jones from sitting in that seat and find Mother Jones a new seat for her to sit in. And then your ministerial staff, they don't get to sit in the ivory tower. It's all hands on deck. So opportunities to serve, giving back to your community during the pandemic. A lot of people have been afraid to go to the grocery store because they're afraid to come in contact with somebody with COVID-19 or afraid to touch money or afraid to touch boxes. And there's no evidence that COVID-19 can be spread through food or food packaging. There's a lack of money to buy food or people have no jobs. So the fact that our communities are hungry and it's important. So how do we feed the people? We get contracts with local food banks and the U.S. Department of Agriculture. They have boxes, 30-pound boxes that have melon, lettuce, cauliflower, peaches, potatoes. Some of them have eggs. The last box that came from USDA had a dozen eggs, a gallon of milk, some cheese, these huge frozen chicken pieces that you could make tortillas out of or put them on chicken Caesar salad. So they're really getting inventive. You've got to have waiver for workers when you have food distribution at your churches. Have waivers so that the workers won't get hurt. We had a young lady who was helping. Her foot got run over by a car while she was out there helping to distribute boxes in the cars. People need to understand you have to keep a certain distance from the car when you're going to put the boxes in the cars. Volunteers, you need vests, those beautiful glow in the dark green vests for your volunteers, and they need to always wear masks and need to wear gloves. These cars are dirty. When people come by, they need to have their masks on in their car. We have a campus-wide mandate that you must wear your mask on campus. So if you're in your car, you have to put your mask on. No mask, no box. We have to find out if you want your box in the trunk or if you want the box in your car. If we open your car door and you don't have a mask on, we're exposing our volunteers. So put that mask on. Forklifts and other equipment. You may not think about it, but at first we were having boxes distributed to our church with a truck that had the gate that goes down and you're able to bring the boxes off with a manual forklift. They've gotten to the point now where we have 18 wheelers showing up to our church with 30-pound boxes of food. We had to rent an electric, not electric, but a propane powered forklift so that we could get those off the truck. So those are things to consider. You have to have procedures in place. You have to have procedures for how people are going to line up. Once you give out free food, everybody and his grandmother is going to be coming. We have people, we're located in Maryland, but the license plates are DC, Maryland, and Virginia coming to our church. And one woman had a Texas license plate. So you don't know who's coming to get food from your church, but you have to have procedures for all these people driving on your campus. And you have to have people who are acting as stop and go traffic control so that they can keep things orderly. You've got to have partnerships with other churches. Some churches are very small. Some are extremely large. We have a large church, so we have small church partners who can come and get 30 boxes from us so they can take them to their elderly, or come get 100 boxes from us and take them to their church for distribution. We have to have the police involved because they need to be there to make sure that we don't have lines of traffic on the street, which would be a traffic hazard. This is an example of how we have chairs set up, and I don't know if you can see this plexiglass, but our church, they have built plexiglass so that you fill out a form and saying, do you have any of the following, a temperature, a cough, a cold? You fill out this form every time you come to the church. They do a temperature check with the gun, and they check to see if you have a waiver, and then you're allowed into the church. So we have these stations set up at every portal of entering our church. Plus, we've limited the access points to our church. So whereas we may have had 6 entry points, we only now have 2. So that limits the amount of space where we can come into our church. When I say all hands on deck, this is me putting boxes into the trunk. I go out every Saturday from 10 to 2 and help put boxes in cars. This is our pastor. He comes out, he's loading trucks. We have father, daughter, and husband, wife teams that come out. We do have all hands on deck. One of our pastors, associate pastors, drives the church truck and takes the boxes. As you can see, we've had to have 2 lines to come through to get boxes. Where you can't see the cars that are closest to the screen, there are boxes behind there. That's how we're giving boxes to those groups of cars. So we have 2 aisles of cars. We have 2 people per pallet that give out the boxes. And one person helps to bring the cars a little closer, because you have to bring the cars close enough so that you can we have 4 cars lined up with 4 sets of pallets so that we can give it out to 4 cars at a time. So 4 cars at a time times 2 aisles, that's 8 cars. We have had 1,000 cars on our campus per Sunday. We have between 750 and 1,000 boxes. That's how we give it out. African-American sororities and fraternities are so important. Betty, we have your sorority up there, Alpha Kappa Alpha up there. We involve each one of the sororities and fraternities in our volunteerism. You have to have a whole host of volunteers to be able to get this thing off the ground. As you can see, we have our Face Strong hats and our Face Strong masks that our pastor is wearing. I did a selfie. My pastor got me into doing selfies, but I've got on my vest and I got on my Delta mask. But this is what we do. We involve all the sororities and fraternities in getting out here and being volunteers. They all have to do public service. So get them as your avid volunteers, along with various members of your church. Here are some more boxes. This is one of the smaller trucks that we have our church. We fill that truck up and take boxes to other locations for other churches to be able to use. Not everybody has equipment, but they have hungry people. So think about everybody being hungry, and don't just think about your own congregation, and don't just think about the people that are going to show up where you are. Partners, think about other churches. There are mosques, there are synagogues, there are other places of worship that we can partner with. They want to partner with us. We're not just the Baptists, the Methodists. Come on now. We're all one church under God, all under God. There's one Lord, one faith, and one baptism. So keep that in mind. The United Way is out there to help us. There's the Department of Recreation and the Department of Transportation. They can help us to get some of our programs off the ground. There are local transportation access. There's a ride share access for elderly and disabled people that we can use. There are carpool. Think about using organizations like the Links and the Masons and Eastern Stars. They're not just there to look good and have social functions. They're there to help you as well. Limit misinformation. I'm coming up towards the end of my presentation, but you've got to keep misinformation out. You've got to know the facts. Go to the CDC website daily to get facts on COVID-19. Excuse me. Once you know the facts, you've got to share the facts. Share them with your peers. Share them with your congregations. Keep politics out of the conversation. It's not about Democrat, Republican, or independent. It's about the health of our people. So keep the politics out of it. Keep the message simple. Simple. Get tested. Wear a mask. Keep 6 feet apart. That's very simple. And keep that fact in there about the 15 minutes of exposure in a 24-hour period. Keep that new information, that new piece of factual information. Keep that message simple so somebody will know. Use credible sources like the Centers for Disease Control. Don't use some Wikipedia source. I like Wikipedia for some things, like finding out about how this actress or actor was doing, but use a credible source that knows the real statistics. And then acknowledge that fear and uncertainty exists within our population and even amongst ourselves. That goes back to breathing. How can you be a change agent? This is what I'm posing to you. What have you done? What is working? Where do you need assistance? This is where we can bring in the conversation. I'm going to come back to that slide, but we're going to go to questions and discussion, but I want you to go back and think about how can you be a change agent? What have you done? What's been working? Where do you need assistance? So we can open up a dialogue. And Dr. Holly, this is where you come in, I think, and Mr. Kim, where you come in to see, Mr. King, I'm sorry, to see where you come in to see how we can channel in our participants today to get in on the conversation. Thank you.
Thank you, thank you, thank you, thank you, thank you very much. And we certainly have some questions. And before I engage the first one, I just want to share, in listening, so much information you shared, so much valuable information from what my language, of course, all of it being insightful. But part of the beauty of the way you shared it is rooted as much in sound research as practical insight. And thinking about, for example, when I think about the latter, I think about the image you showed, the way your church is organizing its food delivery. So with that being said, and I wanted to share that, Reverend Sammons Hackett, because one person right off the bat, before I get to the questions, just commented that the presentation, one of the reasons the presentation is so valuable is because it reminds this particular pastor that we have a vibrant Black church only if our Black communities are strong.
Yes, yes,
So,
yes, amen.
And so I just wanted to comment there before I dive into the first question, which is in reimagining church post-COVID, what do you envision from a health perspective?
Oh, post-COVID, we're still going to have social distancing post-COVID.
Mm-hmm.
Because everybody's still going to be afraid of the disease. That's not going to go away. A vaccine can help dispel some of that, because and I'm going to say when, not if, when we get the vaccine and when we're all able to be vaccinated, that will lessen the fact that we'll get the disease, and then we'll all start to want to congregate again. But our congregating will be different. We're going to find, during COVID, we found better ways of doing church. I know that my pastor preached to an empty church with a full band on social media every Sunday. And he still does it every Sunday because he believes people should still get the word. And he preaches as if the church is packed. And I've been in there when he's done it, and he's preached as if he has eye contact, as if he's preached to a packed congregation. So I think a lot of media ministries are going to be going out even after COVID-19. A lot of our meetings will be conducted. We don't have to come in for an usher meeting anymore. We can do it via Zoom. Right. We even have social school, Sunday school. We call Sunday Biblical Institute. We're doing that by Zoom with 100 people now every Sunday. We have our discipleship training. We're now doing with Zoom with breakout rooms. So coming to church in inclement weather and having our elderly come out to church and things like that. Post-COVID, we're going to be able to do a lot of these things through media.
Absolutely, absolutely. And I think one person raised this question right before you introduced the slide. Know the facts, share the facts, keep politics out of it, use credible resources, acknowledge fear and uncertainty. But I still want to raise the question because I think this question was raised on a couple of different occasions in different ways. But how do we get people to trust what we hear concerning COVID-19? And you shared before that slide about know the facts, share the facts, etc. Visit the CDC website daily. So in answering that way, is there anything else that you would add to that answer in addressing that question?
Most people go to the pastor or a minister before they'll even go to their doctor.
Mm,
First line of questions, and they trust you. They trust you more than they trust family members. So if you are the person that they trust most, then you are the person, the front line to convey this information. You're the one that's going to tell them it's okay to get tested. You know, there's no long line waiting. You will get vaccinated. You need to get vaccinated when the vaccine comes out. You need to wear your mask and live by example. Say, I got my COVID test today. I'm wearing my mask. I wear my mask all the time. So leading by example is extremely important. And knowing those facts is important because if they're coming to you as that front line, then you need to know as much as possible so that you can convey it to them so that they can convey it to somebody else. Because you know they're going to say, oh, Mabel, you know, the pastor told me, and they're going to pass that on. You want to make sure that they're passing on the right information.
great, great, excellent. And again, all of this, all of this is deeply related to where you ended, almost quite literally with how can we become agents of change. Awesome. Let's move to another question here. In the beginning of your presentation, you noted the who, what, when, and where. And one person wants to know, is that related to contact tracing? And either way, would you discuss a little about that?
Oh, good. And contact tracing. And I'm sorry I didn't have contact tracing on a slide, but contact tracing is extremely important because that does deal with the who, what, and where. If you have COVID-19, they want to know where you've been in the past few days because it's not trying to know your business. They want to know who you've been exposed, who you've exposed to this disease. Were you on an airplane? Were you in a meeting? Were you in the grocery store? So who did you come in contact with? And then they want to be able to contact those individuals to let them know somebody that you've been in contact with has COVID. They're not going to tell them your name. They're going to say somebody you've been in contact with has the disease and that we strongly suggest that you get tested. That's what contact tracing is all about. So if you've only been in contact with 2 or 3 people, people may say, I wonder who has it. I wonder if it's you or if it's you. Well, so what? If you've got it, you want them to be tested so that if they've got it, they can get treated as soon as possible. And that's what contact tracing is about getting tested and treated as soon as possible. And I hope that answered the question.
Absolutely. I think, given where the question came in the context of your presentation, I definitely think that helps. You commented, we'll see, another question comes in the context of your noting the significance of asymptomatic carriers. And this person commented that at one point in the documentation of COVID, that asymptomatic carriers represented a significant portion of COVID cases. But the specific question is, do we yet know what kinds of factors contribute to asymptomatic conditions?
We're still studying it. We don't know. So it just like people have other diseases, some people have symptoms and some people don't. And unfortunately with this disease, some people don't have symptoms, which puts us all at risk because we don't know. It's not like they're wearing special goggles and we say, that person with goggles has COVID. Right. No, there's no special designation put on them. And even if a person has a little bit of a cough, you don't know if they've got COVID or not. So these asymptomatic people, think of it as the HIV epidemic. Think about HIV and how people were exposed to HIV, and think about some people not looking, oh, you don't look like you have HIV. Well, what does HIV look like on a person? Does a person have a sign on their saying, I've got HIV? Do they have to be gay or bisexual or whatever to have AIDS? Think about it in that context. So knowing that this is asymptomatic in a far larger portion than it is symptomatic, there's no sign on our forehead saying that we've got the disease, and they're still working on how this is done.
Excellent, excellent. Actually,
Excuse me, just on that subject, that's why children are carriers, because the children haven't been showing the symptoms that the older people with comorbid conditions have. The older people with the comorbid conditions are the ones that have the really bad symptoms. The children have no symptoms and they come home and give it to those older people or the people who have comorbid conditions in their households. So that's important, that somebody with no symptoms bringing it home.
Great point. In fact, thank you for volunteering that point, because closely related to the question about asymptomatic conditions, someone raised a question about children. So thank you indeed for that.
And that's one of the reasons why, I'm sorry, Mr. King,
please.
But that's one of the reasons why there's such a great debate about opening and not opening the schools, because you've got to have social distancing in the schools. We have a religious school. We haven't opened it yet, but we're preparing. But, having the schools, knowing that these kids are going to be together and that they more than likely, if they're small children, they're not really going to wear their masks properly all the time. They're not going to properly social distance all the time. These are things to take into consideration when we're reopening our schools and our churches, but dealing with small children. And dealing with those idiots that we call teenagers who think that they're invincible and go out there without the mask and go to the beach and go everywhere else they want to go and go into their social gatherings and their parties and bring that stuff back home too.
Mm-hmm. Absolutely. Absolutely. Here's a question. Again, you toward the end of your presentation noted some collaborative ways, referring, for example, you referred to the links, you referred to the United Way. You shared some collaborative ways that we can, as church leaders, rely on certain organizations to strengthen our ability to address the pandemic. One question I think is related to that point, but even speaks more directly to how churches themselves interrelate. And you opened up with that, but the specific question is, what would you suggest? I think that, kind of practical strategies. What would you suggest as ways to encourage AME congregations located in the same area to become a kind of clearinghouse so that a greater need could be met in the community rather than the individual congregation going it alone? So are there any particular strategies with which you are aware?
Well, the best strategy is having those preachers, bishops, elders come together. Somebody's got to spearhead it. Somebody is a champion in that group. You may have 15 churches in an area. Well, one of them is well known amongst the other pastors. He or she needs to step up and say, let me call them all together, get the church secretary to call them all together and do a Zoom meeting and say, how are you doing? I'm concerned about you. I'm concerned about your congregation during COVID. And then talk about how can we engage our communities? What needs do our communities have that aren't being met? How can we meet them together? Can we work on a plan together to try to address this and help our joint congregations? Our church is doing X, Y, and Z. We'd love to partner with you on this so that everybody can, avail themselves to this, so that it won't just be my church, my congregation, my denomination. That's the best way I can put it out there. And there is a champion among each of you.
Mm-hmm. Mm-hmm. And again, if I understand correctly, that your point about a champion among us, that is a part of the responsibility of owning and growing into change agency, correct?
Yes, absolutely.
Absolutely. Well, let me share. There are a couple of comments that have come in. I want to acknowledge before we dive into a church, because I think they're very pertinent to what you shared. But one person just acknowledged a deep appreciation for your clarifying the facts around contact tracing and how information is shared. In fact, several reports have come out that Americans in particular tend to be very cautious relative to other developed nations. And so that clarification, I want to share with you that clarification is crucial. So let me, with that being said, let me ask, raise here one more question. One person on a fairly specific note, kind of like contact tracing, wants would like for you to address the 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 process of antibody testing. You know, kind of what is it? You know, what happens as a result of that tracing testing?
Okay, antibody testing. They take, okay, it gets gross, but um, you go to a facility and usually the person's got dressed from head to foot in protective equipment. And what they do is they tell you to pull your mask down to cover your mouth, but expose your nose. And they take a very long Q-tip and they put it up your nostril and they wing it around there a couple of times. And my husband says it feels like they're trying to Q-tip your brain, but they have to do that in order to get the nasal swab from the most reactive part of your nose, which is way back here. And they do that, they put it into a tube of solution and break it off. That goes to the lab to be tested. That's what they call the antibody testing. So that's what's done. They have a rapid test, which within 25, 30 minutes, you can get your results right there. That's not the one that they're offering to the general public. They're offering that to people who've been, you know, they've seen the exposure and they're trying to get a test done quickly so they can get them not to have to go into the ICU. But the regular testing is done. They send it off to a lab and within 5 days, you get your results back. And our results have gotten back in 3 days. And they give your results back either by phone call from the health department, through an email, through a text message, but they're going to find a way to get the information back to you. But that's how they do it. And then if you have it, that's when they embark on contact tracing.
Thank you. And just to let our audience know, we will not be able to get to every question. We certainly want to raise a few more, respecting the time and our ability to close in a way that respects the value and profundity of the information shared. So let me, with that being said, we have captured all questions. And so if we don't get to your questions, we will address them so that they're otherwise available. So with that being said, Reverend Sammons Hackett, two more questions here. One person being moved particularly by your presentation around the topic of mental health, would like for you to explore again, particularly knowing that it appears, according to data, that we will be quarantining in some capacity for several more weeks, if not months, to revisit that point about those practical mental health measures that can be taken as we stay at home to, you know, and all the while protect our sanity.
Okay, you brought up a very good question. While we're in physical isolation, and remember, we're physically isolated, but we still can be socially integrated now that we have the power of video. We can use our phones, we can use our TVs, we can use our computers. We can use all of these things to still remain connected with people. So think about it as being in a physical bubble of isolation, but socially getting out there and being in contact with people. That's going to be the most important thing that you can do, is to still call people and to still do your Zoom calls and phone calls and whatever else you can do. But don't just be in physical isolation and feel that, okay, I don't have to talk to anybody. I'm socially distancing. That socially distancing has a misnomer to it. Socially distance means physical distance. It really means physical distancing. It doesn't mean taking yourself out of the social circle altogether. We have sorority meetings on Zoom. So we still have our sorority meetings and all the programs that we foster. We're still doing those via Zoom and other social media platforms. So we're not isolating ourselves that way. We're just physically isolating ourselves from each other. And that's the important thing to remember. And that's why I talked about calling trees and things of that nature, because the elderly are the ones that we most often don't call and don't think about. We're used to seeing so-and-so sitting in the pew, but we don't think about calling them. Mother Geneva from our church, she's in her 90s, and she wears these big, beautiful hats every Sunday. And people don't even wear hats at church anymore. Mm-hmm. She wears these big, beautiful hats with coordinated shoes and gloves every Sunday. I miss her, but that's one of the people that I send cards to and call. Let me wrap my cards, send cards to people, just a little card to say hi. That means the world of difference. Somebody will have that in their hand for weeks or months and will make the difference with somebody feeling socially isolated. You don't want somebody to feel out there to feel depressed, because depression during the cold winter months are really going to work on people, especially since COVID is here. But having groceries delivered, is a good way for them to get, 2 minutes of contact, but they can stand socially, drop the groceries off and stand there 6 feet apart and have a conversation with your masks on. Things like that. There are little things that you can do.
Absolutely. And again, on the note of the little things, great distinction between physical separation versus radical isolation, right? That they're two different phenomena. And in fact, to your point, they should not be commingled. Appreciate that distinction. One more question here before we allow you and Dr. Holly to wrap up. The question has come up, what do we need to be tested more than once if we're not showing any symptoms?
Oh, that's a good question. I've been tested twice. And one was because I went to a state that was a hotbed. So if you're doing any kind of travel anywhere outside of where you live, you're going to another state, you're going to visit family, be tested before you go so that you will know if you've got the virus, so you don't take it to wherever you're going. When you get back, 5 days after you get back, get tested to see if you're not bringing something back from where you're going. Don't wait for the symptoms to pop up. By then, you'll be in quarantine in a hospital on a ventilator. Right. Why would you want to wait that long and wait for some symptoms to pop up when testing is readily available? So don't wait for symptoms, but those are some of the reasons why you want to get tested if you've traveled out, or if you're in an area of people that are congregating. You're spending a lot of time, you're a worker and you're in a store, you're in Costco, and people are supposed to socially distance. I've seen the X's on the floor, but you've got a lot of people that are maybe a set of family coming through the line. You don't know, you might want to get tested more often. Or if you're out there feeding the community, you might want to get tested more often because you don't know if you've come in contact. Just simple things. Know where you've been, know where you've gone, know who you've been around. And if you're around silly people who don't wear masks, that's a reason to get tested, because of those silly people who don't wear masks, because you don't know where they've been.
Absolutely, absolutely. Well, I tell you what, let me just say on a personal note, personal to the extent that, of course, I represent the institution as the president's executive assistant. I almost begrudge Dr. Holly's role to close this out because this is this has been, I said it earlier, informative in a full holistic way, and again, you know what, I want to conclude by revisiting. I think the slide that captures the both the value of research and what we can do at practical levels to, as best we can anyway, manage the pandemic. And this totally relates in so many ways with how we as an institution try to live out our mission and vision. But know the facts, share the facts, keep politics out of it, use credible resources, and acknowledge fear and uncertainty. With that being said, again, I thank you immensely. And more important, Dr. Holly, I pass the baton to you.
Thank you, Mr. King. And I just want to ditto exactly what you just said. Reverend Sammons Hackett, you have truly blessed us with this needed, informative, inaugural PAINS webinar, COVID and the Black Church. So on behalf of our president, Dr. Michael Joseph Brown, PAINS faculty and staff, we want to extend thanks to you. Thank you, Reverend Hackett, for allowing God to use you through the vast health expertise that only God could have equipped you to acquire for such a time as this, to undergird us with a knowledge base about COVID-19. I'm almost about to shout because it has been so needed. And I just thank God that you accepted the time to come and share with the pain community and communities beyond pain. What you have given us will enable us to use at our churches and throughout our communities to remain safe, to survive this pandemic challenge that we are facing globally. I want to thank all of the participants, all of the attendees who have joined us in PAIN's public inaugural webinar experience, to include clergy and laypersons from the Cincinnati-Dayton district and their presiding elder, the Reverend Dr. Melanie A. Valentine, the clergy and laypersons from the Columbus Springfield Xenia district, my presiding elder district. We want to thank those persons all the way from the motherland. We have members of the graduates of the class of 2020 from the 15th Episcopal District, Cape Town, South Africa, on this webinar, along with persons who have joined us from as far away as Louisiana and Kansas. I want to thank you, Mr. King, our executive assistant to President Brown and Director of Institutional Development, in moderating this event. And I thank you that God spoke to you through the vision that God gave me, and you took it and you went running with it. So I want to personally thank you. I want to thank Ms. Charlisha Rankin, our development associate. Without her, this would not have been possible. And I also thank Ms. Wanda Yancey, who helped us to beta test this event, who is Ms. Yancey is our presidential office coordinator. And finally, I want to personally thank my Bennett Bell sister, Reverend Doreleena Sammons Hackett. You have equipped us with tools for hope through your presentation to continue to face the future challenges, moments that this COVID-19 will reveal. And I just want to close with this poem because this particular liberationist theologian, he said it best. His name, Ruben Alves. He said, what is hope? It is a presentiment that imagination is more real and reality less real than it looks. It is a hunch that the overwhelming brutality of facts that oppress and repress is not the last word. It is a suspicion that reality is more complex than realism wants us to believe, and that the frontiers of the possible are not determined by the limits of the actual, and that in a miraculous and unexpected way, life is preparing the creative events which will open the way to freedom and resurrection. The two, suffering and hope, live with each other. Suffering without hope produces resentment and despair. Hope without suffering creates illusions, naivete, and drunkenness. So let us plant dates, even though those who plant them will never eat them. We must live by the love of what we will never see. This is the secret discipline. It is a refusal to let the creative act be dissolved and in an immediate sense experience, and a stubborn commitment to the future of our grandchildren. Such discipline, love, is what has given prophets, revolutionaries, and saints the courage to die for the future that they have been assigned. They make their own bodies the seed of their highest hope. My last statement, hope is hearing the melody of the future, which you brought to us, Reverend Doreleena Sammons Hackett. Faith is the dance to it. May God bless you. May God bless all the participants. May God bless Payne Theological Seminary. May God add a special blessing to our president. Without his bold leadership, this would not have been possible. Thank you.
Thank you.